Hi guys, this is JAIMIN Singh Rao, and after a long time, today I am going to making this video for the student who is a second year student who are going for your MBBS second year student and who are interested to that which book they have to study for your second year MBBS. So I will give few list of books that will be given according to your level of study, according to your knowledge, how far you are, according to your position of the study level. As where I told you that one video of the first year MBBS I have also given, and that that was video. You can also the wants to know the knowledge about the first year who is a student in the first year, so he can also watch that video and it is given in the description. So guys, today my result has come and I have passed this exam second year MBBS, and I'm now officially I'm third year profession. So guys, I'm what strategy I have prefer for passing my exam, and I will tell you that which book you have to learn for from your second year for your passing your exam or for your for knowledge. So guys, I have there, as we know that in second year there are three types of subject: pharmacology, pathology, and microbiology. So first we will discuss about the pharmacology. So guys, you all know that in pharma there is a one book that is a KDT, and this is my KDT book. So all know that it is a standard book, and all maximum in all student are preferring this book for any query related. So KDT is a one of the standard book which you have to prefer. If you think that if you are problem in learning or understanding the medical language, that is might be a difficult for you, or if you have less time, or if you have anything reason that you have to study less with a smart work, so I will give one another book that is Sandbag. Paravi Sandbag, very good book, and it is given a very in this book you can learn the mechanism of action, and there is a any kind of a drug, the mechanism of action is explained very best, and it is in a flow chart and very for an average student or for to passing the exam, this book is a very good book. But for knowledge and for your further so KDT, whatever you like, I have written, I have read both these and apply my knowledge according. But if you want to learn to both ready both thing, okay, you can do. But see, you what according to your knowledge, according to your hard work, according to your, I said no, what is the situation. If you are you can learn everything, so KDT is the best standard book, so prefer only KDT. But if you have less time, so go for a Sunbird. So these two book I will best book. Okay, there are many book, but I will prefer two books only in the pharmacology. Next, before further go for the vast subject that is a pathology. Yes, pathology is a very vast subject, as there are as according to a NMC rule, now new rule, the second year is of 11th month. So it is very difficult according to learn whole pathology. Okay, so I will prefer as standard. You know that Robbins, I have a 10th edition and I have a two volume. This is a volume 2 and this is a volume 1. You know that these two book, there are two types of the volume in the Robbins. It is a very best book, and if you read this book, the language was, as I told you, Kedit is this language is very South Asia edition, so the language is very hard. And if you, as I told you that if you can, if you have to if you want to go for a standard book, if you have to bring more knowledge, more if you are giving a more time to study, so go for the Robbins. But one of the disadvantage of this book, advantage I have told you that, but one of the disadvantage that it is very difficult to understand while reading the first time, so you have to read 2 to 3 times. But the if you read whole, so it is a very good for you for your competitive exam, that is a next or NEET PG. So I prefer this book for the I prefer this book for the student who are wants to knowledge or very much interested in the pathology, or another book I will show you that, that is Hirschman. So Hershmon have a one whole book, that is I will show you 1 second. Yes, guys, this is the Hershmon book. As you know, pathology. For like Sandbag, the Hershmon is a very easy to read. Means the language of this book is very easy, and this is the whole book. I have a 8th edition. Hershmon, you can see the labeling. 8th edition he have written. So if you are average student, or if you wants to if you have difficulty in reading English, or if you are less interested to in pathology subject, or if you want to just pass the exam, so this book is a very good book. In this book there one a small rapid revision book based on Hartman. You know the written that this is a rapid revision. इसकी छोटी बुक है, सब यही अंदर का है, बस छोटा अक्षरों में दे दिया है. As you know that this is a very you can see no written at a very few small lines, and this is a two write copy of this, but for revision it is a good book. In this book that there is a histological diagram are not properly not given in this book, so for diagram you have to go for this book. But for rapid revision, if you are, I have read this also. For revision for a very good book, that this is a very good book. As you know that for but diagrams and histological diagrams are less given, so not given in this book. So you have to both mug up, and both this book you have to know read both dependently. So most of the student what are doing that don't giving importance to this book, important to this book. But I think that this is also good book. So if you have a time, if you are, I give a one another suggestion, those students who have to just pass the exam. So guys, listen, no, this is also a very big book, no, you know that, and it is very difficult for every student to read every line to line and know the every concept within a 11th month. And I have told you that within a 11 month it is very difficult to understand the all pathology. So what we will do. So if you are very much interested, go for a Robbins. If you are average or wants to learn, just pass the exam or have good marks. So for Hershmon, you can also do the reading thing in this book. And further, for diagrammatic view, for diagrams, you have to prefer this book. Getting no? For theoretical, you can refer this book. And for diagram related to this theory, you can refer this big book. So you know the value of the Hershmon. Okay. There is another book that is of pathology. I would like to describe this book. I have brought first this book. That book name is Gitika Khanna. But when I read this book further, this is a very good book. But it is given in a question answer pattern. So if you wants to, but I don't think that this is very much interesting book, or doesn't matter if you're reading a Hershmon book. So no need to read this book anymore. But if you are difficulty in this book Hershmon, okay, so then you can refer Gitika Khanna. But I suggest you from my heart that is this is a good book Hershmon. So बात की एक बात, Hershmon is a good book. So refer this book. Okay guys, now I am going to discuss about the another subject, that is I think this is a very a boring subject. I think microbiology. There are viruses and but it is very important. But virus and other, so many students what are doing that, as I know, as I have done. So I know the experience that what are more weighted subject we are giving to the second years. So most weighted subject is mostly pathology and pharmacology. Most of the students are not giving a response to this third year, that is a microbiology subject. So guys, but you have to study as the is in the syllabus. So you have to study all this book and professional topic given this. So as this book is a Sastri, Apurva Sastri, and this is a very standard book for this. I prefer for your exam. This is a good book for your exam and for your knowledge thing. So guys, this one is a good book for, but if you are a student that you are a difficulty in understanding this language, and this is a very vast book and the language, it's a, what are your brain will become a, what means brain will be so the student who are thinking that this is a how can I read? This is very boring subject. Microbiology I don't like. So I have another book that is Nagoba, B.S. Nagoba. So in this book, as Gitika Khanna, in this is not, I am not damn sure that you will pass the exam. I am not telling that you will pass the exam, but most of the topic for your understanding purpose is given in this book, and it is a given very point wise. I hope it's not. I can tell that I have read this book also, but it is a very good book. If you want to understand this book, so first read this book, and if you are reading, there is a given in a question form, and if you are a student who are preparing microbiology in a last time with because exam before your pre-university exam, if you have only 2 months or 1 month, and it is very difficult for a student to complete all this syllabus with pathology, my pharmacology. So Nagoba is a good book. Okay guys, so I hope you like this my video, and after a long time I am coming back on my YouTube channel. Due to some reason I cannot making the video till date. So guys, we will now going for the I'm going to experience my third year. That is how I prepare my third year. I will share this the book's review book of this video of third year after few days or a few months, or okay, I will decide after my I clear my exam, because after clearing we know the knowledge we have. How, what is the strategy you have? I have cleared the second year. So second year, from now new curriculum 11th month, so you have three subjects. As I know, the FMD, forensic medicine and toxicology, is now in the third year. Before my seniors in the 17 batch, or there who are in the final year now, they have a FMT, that is a forensic medicine and forensic medicine toxicology. That subject is in the second year, but from the new curriculum, so we have doesn't have a FMT subject. So FMT review will be given in the third year. So now you have to concentrate on a three book. I will again repeat it: pharmacology, pathology, microbiology. And if you are going for a standard book, FMT is not your subject. For you are going for three subject, that is pharma, patho, micro. Going for a standard book, that is in pharma you have a KDT. In pathology you have a Robbins, very excellent book, and in microbiology Apurva Sastri. Go, nothing you have to do this. You have to read this. You will much. You have no. You can solve any MCQ related this subject. You are a master of this subject. But it is very difficult to learn this all subject properly in a 11 month. So go for a, as you're interested, and balance the your journey of second year, and balance your journey with a proper uniformly proper your neat and clean work of daily study, daily routine, making your daily subject to study properly about what you wants to inspiring from your daily clinical postings. And I will prefer that go for most for the clinical posting, mainly the pharmacology and pathology. It doesn't have that much, but you are going for a posting that you have posted from any hospital and department, like a emergency department, pediatrics. So learn from that only, because that is also correlated with your subject. But main, that is a pharma is very interesting subject. You know that pharma and patho, these are boring subject, means you have to mug up. You doesn't have any chance, but you have to mug up. You have what? I have beta blockers, so you have to learn all the series of timolol, osmolol. You have to learn this all the drugs of the beta blocker. So three generation, and okay. Then further we will go for going for the hypoglycemic drug, that is anti-diabetic drug. So you have to learn that glipizide and glipizide, sulfonylureas, tolbutamide, so and etc. That you have to learn and mug up. That is you have to ratta marna hai desi mein. You have to ratta marna hai bas. You have to mug up everything. But what we can do? You have to learn now. There is a many tricks given in a many platform of the YouTube, or how to learn that drugs name and difficulty with the student who are difficulty in getting to how to learn the how to learn the drugs. So you will go the many platform on the YouTube or Marrow or Prep Ladder and etc. Many things are PG, or simply if you are a student, you have to go and choose any Marrow Prep, or as you know, the your senior and according to your college and circumference, according to your environment of the college and how your university is preferring. So guys, thank you for listening my this video, and I hope you are well at your home and doing a well job. And I hope best of luck for your exam, semester exam, and everything, your semester or PUC UC exam for second year. So thank you.